Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about rehabilitation. We'll hear from three specialists who work in the field of rehabilitation about physical, occupational, and speech therapy and some of the specialty therapies available across the North Shore. So we'll start first with Mike McNeil. Welcome to the show.
Thank you. Good morning.
Really excited to have you here. Pleased to be talking about rehabilitation because I think that's an area of medicine that we haven't covered on the show before.
Right.
So why don't you start off, tell us a little bit about your background and what you do at St. Tammany Health System for therapy and wellness.
So I've been doing it for quite some time. Prior to coming to St. Tammany, I was involved mostly in private practice, and I've been with St. Tammany now for 5 years in the director position. So I'm director of outpatient rehab services for the hospital, and so that kind of covers a lot of different areas: physical therapy, occupational therapy, and speech therapy. So that's kind of what I'm over with the hospital.
Right, and so those three are kind of the major disciplines. So let's talk a little bit about what that means, physical therapy specifically.
Right, so starting off with physical therapy, so that's basically, you can be treating a orthopedic patient, so somebody that had a total knee replacement, somebody had a total hip replacement, somebody that's had back surgery, rotator cuff problems. We also treat pediatrics as part of our physical therapy department. Even things like little babies with torticollis, we can address that with physical therapy. So there's a lot of different things in the pediatric world that we can work with. With getting back to the adult side, we also treat a lot of neurological patients. So we have Parkinson's disease patients. We have a specific program for Parkinson's patients. It's called Big and Loud, and so that is a program designed specifically for Parkinson's patients where they come in 4 days a week for a month to address either movement impairments, difficulty with coordination, strength, and then the loud component is actually part of speech therapy, which we'll kind of touch on in a minute. And so, we also treat obviously strokes, brain injuries, multiple sclerosis, Guillain-Barré, ALS, many different diagnoses that we treat from a physical therapist perspective. With regards to occupational therapy,
yeah.
We treat a lot of similar diagnoses, not so much knees, hips, lower extremity joints. Occupational therapy doesn't address those. They tend to address more of the upper extremity, the arm, so hand and wrist, elbow, shoulder, things like that. Occupational therapists also work a lot with our neurological patients, helping them relearn or teach them how to adapt to their stroke. And if they have impaired movement of their arm, we teach them strategies to be able to do activities they used to do in a different way, whether it be with adaptive equipment, whatever the case may be. There's adaptive feeding utensils, adaptive reachers, all kinds of stuff that occupational therapy can teach patients to use to help them modify the way they perform in their activities of daily living.
Wow.
And then finally, we offer speech therapy. Speech therapy, obviously, no pun intended, kind of speaks for itself. But you're working on people that have speech issues, but that could be from a variety of problems. So, yes, it could be from a stroke. It could be Parkinson's, like I mentioned. A lot of Parkinson's patients have trouble projecting their voice, and so they need to work on increasing their volume. They can work with patients with vocal cord dysfunctions, and they can also work on patients having swallowing issues, which is a very common issue depending on the diagnosis of the patient.
There's a pediatric component for all three of those, physical, occupational, and speech.
Correct. So at our main clinic in Covington, we have little bitty babies coming in for therapy all the way up to 100 years old. So it's quite a variety of patients that are coming in. And yes, we do offer pediatrics for all three disciplines.
Well, and you mentioned the main campus there in front of Flower Estates near the hospital. So that's kind of the biggest therapy and wellness location. But you have other locations that are provided within some of the specialty areas that St. Tammany has around the service district.
Yes, we have a lot of specialty service lines, in a few different locations. So we have the main clinic by Flowers Estates. We have the YMCA clinic, which is a satellite clinic. We only offer physical therapy at that location. We offer what's called lymphedema therapy, which is part of physical therapy, and also pelvic floor therapy. Those service lines are offered at the Women's Pavilion. And we also offer physical therapy and speech therapy at the Cancer Center. Lymphedema and pelvic floor are two specialty service areas that are kind of unique. Not every physical therapy location offers that. Breast cancer surgery, and they have to have multiple lymph nodes removed. Lymph nodes are responsible for removing the swelling, so when those lymph nodes are taken away, your body can't drain the fluid as well, so your arm swells. So that's called lymphedema. And then pelvic floor treats a variety of issues, related to, could be postpartum, could be just as we get older, we start having bowel and bladder dysfunction, and then even certain cancer conditions can cause bowel and bladder dysfunction, and the pelvic floor therapist can address those.
Fantastic. Well, I know those are two of the highly specialized areas that you offer, but there's a new one called musculoskeletal ultrasound.
Correct. So yeah, so we've over the last couple of years, our physical therapists have been training in musculoskeletal ultrasound, and so what that is basically a tool, another tool in our toolbox that we can use basically to scan a joint. So it's very similar to when women are pregnant, they get the ultrasound for the baby. Same concept here, except we're doing ultrasound on the shoulder, the elbow, whatever, hand, wrist, to pick up any kind of issues that could be going on. If you have tennis elbow, it's a common thing. You can actually detect that someone has tennis elbow with an ultrasound. You can detect if someone has a rotator cuff tear with the ultrasound. So a lot of soft tissue pathologies can be picked up with the ultrasound. And so what that allows us to do, traditionally years past, a patient would come in, okay, we suspect diagnosis of rotator cuff, but they've only had an x-ray. So then we treat them for 4 weeks, see if they get better. They don't get any better. Then they have to go get the MRI, and that takes a couple of weeks, and before you know it, you're 2.5 months into this process and you're just getting an answer. With this, we can pretty much tell you right away, yes, you have a small tear, or no, there's nothing we're going to be able to do for you. We're going to refer you back to the physician right away. It allows the physician to get the MRI much quicker because they have, the ultrasound scans and pictures that show what's going on, so the insurance is more likely to approve it. It just expedites the care that the patient's getting, makes it much more efficient. And at the same time, even if there's nothing significant going on, it eases the patient's mind because, they don't know what's going on, and they might be worried they have a tear, and we can scan them and say, no, look, everything's fine, it's just tendinitis, we can treat you. So it puts the patient at ease, gives the doctor confirmation of what they were thinking. So it's a wonderful tool that we're excited to add to our service line. We're primarily offering that on the outpatient side at North Azalea and also at the YMCA. But also on the inpatient side, the physical therapists are also training to do that as well, to offer that in the emergency room as an adjunct to diagnostic services that offer the emergency room, again, to expedite the diagnostic process and the care that the patient's receiving.
So that's fantastic because it means between St. Tammany Health System and Ochsner that you have physical therapy, occupational therapy, speech therapy, and specialty therapies throughout the service district. So people in Mandeville, Madisonville, Covington, Folsom are going to find a convenient place that they can receive the care they need, and you all can do that in conjunction with the primary care and specialty care that's available at St. Tammany and Ochsner.
We also have a great collaboration with the Cancer Center, which opened last year. Especially the physical therapy side has just exploded with the patients that we're seeing over there.
Well, Mike, thanks for coming in and telling us all about it.
All right, I thank you for having me, and I enjoyed it. Thank you.
Thank you. You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about rehabilitation. We'll be right back.
Here at St. Tammany Health System, we're empowering our mothers, our sisters, and our daughters like never before. Throughout our entire system, we've invested in the highest level of technology available to provide more accurate diagnostics, less invasive care, and faster recoveries. Together with our partner Ochsner Health, we're giving women many ways to live stronger and better.
Welcome back to Healthy Living. We're talking today about rehabilitation and learning about the facilities available through St. Tammany Health System and its partner Ochsner Health. In the first segment, we learned about physical, occupational, and speech therapy from Mike McNeil. Up next, we'll hear from Allison Ostendorf about a brand new facility in Folsom that has those types of therapy plus something new called hippotherapy. So welcome to the show.
Yes, thank you for having me.
I'm really excited to hear about this.
Yes.
Talk to us about your background and then tell us what hippotherapy is.
Yes, so I am a PT by background. I've been practicing for the last 3 years, primarily in outpatient pediatrics. I was born and raised in Covington, so very much local to the area, and I'm so excited to be having this new Folsom clinic and our hippotherapy program.
I'm really excited about it too. You know, Folsom is very well known for horse culture. New Heights Therapeutic Riding Center is there, and our new facility is on their campus.
Yes.
So, you know, talk a little bit about what hippotherapy is in terms of bringing therapy onto horseback riding.
Yes, so hippotherapy is basically a fancy word for therapy on a horse. What we're going to be doing out there is using the horse as kind of a treatment tool. So it'll be your traditional PT sessions with the horse included. So what that means is we're using the movement of the horse to provide more motor and sensory input for these patients. So when you think about traditional physical therapy, you and I take a certain number of steps every minute. A horse takes 4 times that many steps.
Wow.
So we're able to get a lot more input for these patients and a lot more balanced reactions and movement throughout the session.
That's fantastic. So I would imagine there are lots of different types of patients who might benefit from hippotherapy. So maybe talk a little bit about what those conditions are or those types of patients.
Yes. So anybody that can benefit from PT may benefit from hippotherapy. Some of the benefits of hippotherapy are increased core strength, improved posture, better balance reactions. Also, any of our patients that have abnormal muscle tone, so the patients like those with cerebral palsy that may have higher muscle tone, hippotherapy can actually help reduce some of that muscle tone. Other diagnoses include kiddos with Down syndrome, any patients after a traumatic brain injury. It's even been researched for things like arthritis. So there's a lot of patients that could for sure benefit from this.
That's fantastic. So it sounds like you've got a wide variety of different types of patients who can benefit from it, ranging from people who've had an incident like a stroke, for example, or people who have a debilitating disease, childhood or adult. So that's a pretty broad spectrum of different types of folks.
Yes.
And so you will be out at the Folsom Clinic, and so talk a little bit about when you're not on the horse, what's inside the Folsom Clinic?
Yes, so I'll actually be the lucky one to be in the clinic and back at the barn with our horses. So in the clinic, we'll be doing traditional clinic-based PT, OT, and speech for adult and pediatrics. And then back at the barn, I'll be doing the hippotherapy. Our typical hippotherapy session is kind of going to be a mix of both. So we're going to have some activities that you would do in traditional PT that are in the therapy room. So things like therapeutic exercise, stretching, range of motion activities. Then we'll go get on our horse and do some activities there to work on some of that core musculature, some balance reactions while we're riding around in the arena that New Heights provides us. And then we'll get off and do kind of a wrap up and cool down. So hippotherapy is kind of mixing the horse with your traditional PT and putting it all together.
Fantastic. And that's physical therapy, but you mentioned that Folsom will also have occupational therapy and speech therapy, and you'll have both pediatric and adult.
Correct.
So really that brings a full service location into Folsom, which is really exciting to have that level of rehabilitation available to our patient population that are north of Covington.
Exactly.
Okay, fantastic. So if someone comes and they do their course of treatment with you, how does that end or does it end? You know, I guess that depends a little bit on what you're treating them for. But talk a little bit about the after effects once they've had therapy with you.
Yes. So just like traditional therapy, we're working on specific functional goals that we can measure. We're still using the same standardized measures that we would use in the clinic when we're doing hippotherapy. So we're working on goals that are taking place off of the horse. So that's going to be things like walking, balance, sitting, all of those things in your day-to-day life. When we're doing hippotherapy, we're still assessing just like traditional physical therapy would. So we're looking at that response. Eventually, the goal is to discharge and graduate from physical therapy. I come from a pediatric background where we see a lot of kids for a long time because of their diagnosis. The goal is to do short bursts of care working on those functional improvements. If a patient discharges from hippotherapy, there is an option to transition to what we call therapeutic riding up at New Heights into a different program where they can still be around the horses and that kind of environment.
Okay, so even in the case of hippotherapy, you're going to have goals that you're setting. You're going to look for certain markers to occur for that patient to show that progress to achieve what they were capable of before the incident, or in the case of a chronic disease, maybe a certain level of proficiency, and that suggests the end of this round of therapy.
Right.
But then, as you were saying, that's when our partners over at New Heights may have a long-term relationship with that patient where they're coming out for therapeutic riding, maybe for their entire lifespan.
Right. So we're lucky to be working with New Heights. They're an amazing program. They actually are going to be offering therapeutic riding as they currently do. So the difference in hippotherapy and therapeutic riding is that hippotherapy is offered by a PT, OT, or speech and is leading with the therapy and using the horse as a tool. For therapeutic riding, it's more teaching a person with any kind of disability or special needs to ride independently. So they would be able to start in hippotherapy, and then if they, of course, fall in love with these great horses, they can stick around and keep riding on their own and become a lot more independent.
And that's in the therapeutic riding realm.
Yes.
Very good. Well, then it makes perfect sense for us to have this opportunity together, New Heights with therapeutic riding and St. Tammany Health System with PT, ST, OT right there in Folsom.
Yes.
Well, that is outstanding. So I'm excited to think about this new one opening, and I believe you have an event on June the 29th.
Yes.
So people will be able to come see it. And then generally, patients who have an interest in being scheduled there would have a referral into physical therapy, and they may also self-refer. Is that right?
Correct. Yes, we'll be able to still do all of the traditional PT services up there, just like we would at the main Covington clinic.
Fantastic. Thank you so much for coming in to teach us about this.
Yes, thanks for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about rehabilitation. We'll be right back.
You can work anywhere, but at St. Tammany Health System, you join a community with a heartbeat. Enjoy summer days on the lakefront, chill rides on the Tammany Trace, adventures on the bayou, sunset dining on the river, and find your groove in one of the many historic downtown districts. Join the heartbeat of our community. Join St. Tammany Health System.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about rehabilitation. We learned about physical therapy, speech therapy, and occupational therapy, as well as some of the specialty therapies, including hippotherapy. Up next, we'll talk with Cassie Thibodeau about hand therapy. Welcome to the show, Cassie.
Good morning. How are you?
Really excited to have you here. And hand therapy is one that I have personal experience with. You helped me with tennis elbow and solved some problems for me. But talk a little bit about your background and how you wound up in hand therapy.
Okay. Well, I went a little bit of a roundabout way. So I actually went into physical therapy, that route. I was a college athlete with swimming, had my own orthopedic injuries, and went through PT and years of that. And so, you know, PT, that's what I always heard. So that's what I thought I wanted to do. So I got into PT school, did the first year of PT school, And then I was struggling a little bit with one of my injuries, and I took a medical leave. And during that time, I worked as a PT tech. And while I was working, I met a patient that was an OT.
Aha.
And I'm like, here I am in PT school. I don't even know what OTs do. What's an occupational therapist? So I started looking into it. I was talking to her, and she worked with brain injuries. So I thought, and she did more of the cognitive aspect of it. So I thought I wanted to do mental health. And so here I am like, that's interesting. So let me apply and let me see what happens. So I applied to OT school, got in, thought I was going to go into the mental health route, and did mental health for a little bit while I was in school. And I actually enjoyed it, but it just wasn't my niche, you know. And anyway, my first job was at St. Tammany. I got into the hospital and worked in inpatient rehab and did acute care for about the first year. And then the opening with hand therapy came around, and I said, and Bert, my boss, came up to me and he said, there's an opening, I think you'd be good at it. You have an orthopedic brain. And I said, I don't really know much about, well, maybe. So I looked into it, I researched it, and I went over to the clinic and I observed Tricia, the other hand therapist, and kind of saw what she did, and I said, that's really interesting, you know, maybe.
And hand therapy, I think, just is fascinating, and maybe that's what drew you there, because the work is so tactile. You
Right.
put your hands on and do work with people's hands and arms to help them regain motor skills.
Right, and it's so intricate, it's such intricate work, and I knew I had wanted to specialize in something. I wasn't sure what at the time, but once I started getting into it and seeing what exactly it was, what types of protocols are involved with hand therapy, with certain types of injuries, and you know, just the detail of it, that was my niche. So I just kind of got into that, and
That is
I've loved it.
Well, and you can tell you love it. You got this glow when you start talking about it. And there are a lot of different reasons people might wind up in hand therapy, but talk about some of the kind of conditions that you treat.
Okay, so we see a lot of post-op injuries for the most part. I do see some injuries conservatively as well, but typically we see a lot of carpal tunnels, cubital tunnels, your tennis elbows, golfer's elbows, a lot of traumatic injuries, so we see a lot of amputations, lacerations, tendon repairs, things like that. So we do a lot of splinting, wound care, and other things involved with getting their function back in the very beginning stages after an injury with a wound, and then we'll progress them, you know, as they heal.
Sure. So there's a whole spectrum there of, you know, someone like me that had tennis elbow. It was just a matter of trying to work with me to get back to the point where I wasn't in pain and I had full range of motion and things were back to what they had been before I hurt myself. And then you got a full range of folks that may be coming to see you for a million different reasons, all the way out to someone who's maybe lost a limb or a portion of a limb, and you're having to help them develop some skills and learn forward how they're going to go about being dexterous and developing as much skill as they can with what they have to work with.
Right, and like Mike was saying earlier, with OTs, they tend to work with adaptive equipment and, you know, learning adaptive tools that they can use to function if they lose a limb or if they have to adapt a certain way. So yeah, we use different tools, like one-handed techniques, things like that, that they can do if they need to, or, you know, different little devices for their hands or orthotics that they can use to function again.
Amazing. So you're meeting with people, you work at the main therapy location by Flower Estates.
Yes.
And so you have folks come in and you work with them. You actually put your hands on their hands, and I'm envisioning some of what we did together when you were working with me.
Yeah.
But then for patients who are trying to develop skills, you probably also do some things where you're coaching them in how to do something.
Right, yeah, and they have certain goals that they want to meet. You know, we make our own goals, but then we're talking, so it's, I mean, the team is the therapist, the doctor, and the patient. So there's 3 of us that are involved. So, I mean, I have my own goals. I want to get your full range of motion back, but what do you want to do? What do you do for work? What do you need to get back to function, you know? So
Right. What were you doing before this happened?
Right, are you a construction worker? Do you need to be able to lift heavy things? Do you go home and garden? What types of functions are we looking at? And so we'll do some task-specific things in therapy if they have specific goals to get them back to being able to do those things again.
And I would think, particularly for people who work with their hands, you may be helping people who are really worried about what their future will be. Someone who works as a surgeon, or someone who works as a woodworker or an artist or a musician. There probably are a lot of different patient types who are trying to understand from that occupational therapy standpoint how they're going to return to doing what they did before whatever happened.
Right, and I mean, everybody's different. Everybody, I mean, depending on what the injury is or the surgery was, some recoveries are a little bit shorter than others, some are a little bit longer than others. So, if it's someone that really, needs to get 100% back, we had a guy that worked on the water. He needed to be able to climb a ladder to get on a boat. He needed 100% strength to do that, because you do not want to fall in the water.
Right.
So there's certain goals that we're looking at when we're working with our patients to be able to get them back to being able to do those things, no matter what their level is. But yeah, we do a variety of things. We do fabricate custom splints.
Wow.
For patients. So if the doctor orders, say we have a tendon laceration and they have to be in so many degrees of flexion and positioned a certain way, we can make a custom splint to their hand to keep that tendon protected as they heal. So, and then we can progress them, to move away from that eventually, but as they heal, as they still have their stitches in and this and that, they have to be in that position to allow that tissue to heal in order for that tendon to get strong enough to be able to withstand the forces of our hands and the pull of our muscles.
The work
in our
we do,
hands.
right.
Yeah, the work of force in our hands.
Fantastic. Well, and I know that there is a program for certified hand therapy, and that's something that you have, and I think your fellow workers at St. Tammany have. So talk a little bit about why that's important, or how that plays into practice.
Okay. Yeah, that's the Certified Hand Therapy program, and it's usually through the, the Hand Therapy Certification Commission. And you have to have 4,000 hours
Wow.
of direct patient care with a patient, with patients in hand therapy. And you have to work 3 years in occupational therapy in order to be eligible to apply. And then once you apply, you study, take the test, then you can add the letter CHT to your name. And that's important because a lot of doctors, especially hand surgeons, are looking for someone that they can look to that can understand the specifics that are in the intrinsic detail that's involved with some of hand therapy
Right.
and someone's rehab process. So they might send an order for hand therapy and they want a CHT that can, be can well understand the protocols
Exactly.
that they need to follow, because it's very specific. It's not just you cut your hand in a tendon and you just try to move it again. It's you have to, keep it protected, and you have to
Right.
move it passively, and then you can only move it so far, and then eventually you can move it this far, and then eventually you can grip things, and then you can, so it's a
Progression, and those
progression.
goals at a time.
Yep.
That's fantastic, and that CHT behind your name suggests a level of proficiency, a number of hours, a number of cases, a variety of experiences, so that those surgeons have confidence that their patients will regain what they need to regain after that surgery.
Correct. Yeah, and we have 2 certified hand therapists. So there's me and then there's
Fantastic.
Trisha Dole, and we work right next to each other, and we bounce ideas off each other all day, and it works well.
That's outstanding. Well, Cassie, thank you so much for coming in to talk to us about hand therapy.
Thank you.
You're watching Healthy Living, brought to you by St. Tammany Health System. Our topic today was rehabilitation. I hope you'll join us for a future episode of Healthy Living.